Welcome to the MMOA podcast. My name is Trisa Hutchinson, Doctor of Occupational Therapy, and today I'm going to talk to you about older adults and driving. Team, we often get asked the question, should mom, dad, grandma, or grandpa still really be driving? And here we have to do a big bias check. We can't just make assumptions about whether someone should or should not be driving. Today, I'm going to share 3 helpful tips to help you navigate the conversation about whether or not someone is safe to keep driving. First, I need you to be clear in your communication and explain why you have concerns about their driving. You need to be using assessments and objective information to drive this conversation. When you're talking about someone's ability to drive, you're actually talking about their independence and their ability to navigate their entire community. So, again, it's important we use objective data. Some things that you need to think about assessing: their reaction time. Are they able to see something on the road and appropriately make the movement, adjustment to their speed, to their location, etc., to keep them safe on the road? How about the same goes for their processing time cognitively? What about we consider checking their vision? Can we do a simple visual screen or ask them if they've had an appointment with their optometrist sometime in the last year or sooner? Vision can play a huge key component in our driving for obvious reasons. However, if we are on the road, we need to make sure that our patients can be seeing far, that they can be seeing near, and that we're also aware of our surroundings side to side as well if there's something going on that we need to adjust for. Another key component can be our hearing. Oftentimes, this one gets overlooked when we're thinking about driving because, yes, people who can't hear can still drive and drive well. However, if it's a change in their hearing and we're not able to compensate well with our vision, it could be considered a high safety risk. I want you to think about if you're driving down the road and you can hear a noise in your vehicle or a noise that your motor is making, or maybe there's some sort of a part that's screeching, or it's giving you an auditory cue that you need to make sure to take this to the shop so that your vehicle is still safe. Now, if someone can't hear that, that could be a huge safety risk for themselves still on the road and others around them on the road as well. Hearing can also be really important when we can listen for those emergency personnel vehicles. Maybe there's an ambulance coming or a cop, a police officer, or maybe like a fire truck is coming and they need to be able to hear those sirens. Yes, they should also be able to see the sirens or see the lights, rather, of those emergency personnel. However, we need to make sure that both are on board or we're at least able to compensate well with our vision if our hearing has difficulties. Another thing to consider is your patient's neck mobility. Yes, a million cars now have those fancy dancy backup cameras. However, they're not foolproof. Your patient needs to be able to turn their head or compensate with their mobility in their spine to be able to turn and check their blind spots before backing out into a person. If they're in the grocery store and they're in a parking lot and they're backing up, oftentimes those situations can be really dicey and they need to be able to physically check side to side if they're safe to move their vehicle. Another component would be medications. Is your patient taking their medications appropriately to manage any conditions they may have? And B, are they taking any medications that impair their ability to operate large machinery? That equals a vehicle. Oftentimes, we think about large machinery as like an excavator or some large bulldozer or something, but that actually also includes a vehicle. So, making sure that if they're on maybe like a higher dose pain med or something like that, make sure that they are not operating a vehicle while taking those medications. The last component I'll touch on for explaining why you might have concerns, that initial part of the conversation, is having some sort of a cognitive screen if you're worried about your patient's overall just processing, executive functioning, decision making, etc. And so, with this, conducting some sort of like a St. Louis University quick screen, maybe you're doing like a mini mental state exam, one of those to help kind of give you some information to, again, guide that conversation as to why you're having concerns. If you don't currently feel comfortable with conducting one of those cognitive screens, I highly recommend checking out our level 2 course online. Here, we take a lot of our information and we apply it to individuals who have difficulties with cognitive impairment. And we talk about when it's appropriate, how to have the conversation, and how to conduct those cognitive screens really, really well. So, team, that's number one. I need you to be clear in your communication and explain why you have those concerns. Think about all of those different factors that could be something to help drive that conversation. Number two, we're going to dive into is encouraging you to make sure you have a standardized measure, or encourage, a standard driving evaluation. So refer them to someone for an actual driving evaluation once you've had that initial conversation. So be prepared with some resources. For example, if they don't want to go anywhere, they're refusing, I recommend you start with the AAA self-assessment. This can be found simply by typing in your search engine AAA self-assessment of driving. Here, they give you a list of about 20 to 30 questions that your patients can just answer yes or no to if they've experienced. For example, fear of driving, feeling as if they need another person in the car to help navigate them, having any accidents or near accidents, things such as that. And then based on their score, that gives you a recommendation for further assessment, or stop driving immediately, or you're good to go. From here, this is a great starting place, but then I want you also to consider sending them to a certified driving rehab specialist. Typically, this is an occupational therapist that's taken this advanced training. And here they take your patient and they put them in an actual simulated driving scenario, and they assess all parts of the process of driving and being a safe driver. And they actually provide those very explicit recommendations in terms of, should driving be restricted to only in town or familiar roads? Should driving be stopped at all causes? Or is your patient good to go, safe? There was some other challenge, but their driving is just fine. So make sure that you're encouraging a standardized driving evaluation. If you don't have access to a certified driving rehab specialist, which, a little tidbit, if you type in your search engine that exact phrase with the locator, there is an actual locator. You can type in your current location and it'll give you the closest individual nearby to send them to or refer to. But if you don't have access to one of those, I would recommend sending your patient to the DMV, or Department of Motor Vehicle Services, and ask them to schedule a behind the wheel exam. I had a difficult time with an individual. I had given him the reasons why we had all the concerns, and so he took my conversation seriously, but he wanted to prove to me that he would keep his license no matter what. And so we had a deal that he would go to the DMV and he would have that behind the wheel exam. If he passed, we would never talk about it again. If he didn't pass, then we would go forward and I would make sure that we're going to, number three, provide him some resources. Um, Turns out that he didn't, in this instance, he did not pass the exam. And then from there, we moved forward in a really positive manner, but it gave him some more concrete information as to, that big change in his independence. So team, number two was that encourage that standardized assessment. Number three, and finally, we're going to dive into, if you end up recommending that someone stop driving, or you have concerns that they should stop driving, or you referred them to someone who told them to stop driving. In any manner, if you are telling someone to restrict or stop their driving, I need you to be a resource dealer and provide them with some hope. Meaning, I need you to have a list of different availability or available options for them to get around their community. And I need you to have that at the ready. Because taking away someone's license, not that we're necessarily taking it away, but if we're recommending that or if it gets taken away from the DMV, you need to be able to provide them some sort of um, ego or energy booster that they're not going to just become a hermit or be socially isolated into their home and never get out with their friends ever again. Some opportunities for getting them these resources, I would recommend looking into if you have a city or community bus. Typically, these are offered for very, very cheap. The one in our town, I think it's like $1 or $1.50 per ride, and that can take you pretty much absolutely anywhere in town. Another opportunities are usually church groups or other local volunteer organizations. Typically will have individuals that are on a list to give people different rides, whether it be for appointments, shopping, groceries, etc. But make sure that you're reaching out and forming that network so you have those contacts for individuals. Also, maybe worth if you're on a good basis in terms of communication with families, um, making sure that your patient is feeling comfortable enough to ask for help or have a point of contact, or at least have like a scheduled day that they know that if they want to get out or do whatever it may be in the community, they have someone that can help support with that. So, team, this conversation can be really challenging, especially because it's not just about the safety of your patient, which obviously is our number one priority in session, but it's also about the safety of everyone else on the road. So we need to remember our three keys. We have to be first clear in our communication and explain why we have those concerns. Then, number two, we need to encourage and refer to a standardized driving evaluation. Think about the DMV. Think about a certified specialist. Maybe consider just starting with that self assessment to help drive that conversation. And number three, I want you to make sure that you have those alternate methods of mobility as at the ready to give them a different opportunity to still get out in the community. Think about those church groups. Think about the community bus, something that's going to still help them maintain that overall independence. Now, team, to learn more about how to navigate all things older adult, I encourage you to grab a seat in one of our next courses. Up and coming shortly, we've got our level 1 online course starting on January 14th, and our level 2 online course is starting on February 9th. I cannot wait to see you there to dive into all things older adult. Thanks, crew.